across the whole, what we call health building blocks of health, I would say there are challenges everywhere. I think the foundational challenge, like discussed in the conference, is really around how we finance healthcare in Nigeria. So if you look at the data, for example, that I presented, the bulk of Nigeria health financing comes from people's pockets. So up to about 75% of spending on health still comes from pocket. That's a bit of a problem because health is not something that gives you notice to prepare. So it means that what we in the healthcare space call the catastrophic cost of healthcare continue to be a major problem. Of course, this is partly a problem because of the limited financing of healthcare by government. So government needs to put more money in healthcare. Government needs to see the business in healthcare and therefore put more money. But I also think that even within the monies that we have within healthcare, we need to get more health for that money, so more value. So that's like the whole financing is a major area. But I think there are other areas. Of course, there are areas how, in terms of how our healthcare system is designed. So for example, if you look at primary healthcare, which is something we are very passionate about as an organization, the vast majority of Nigerians will get primary healthcare at community level. So it's either they are going to their local pharmacy shop or they are going to their PPMV. But if you look at our healthcare design, it doesn't necessarily recognize those two tiers in the PAC system. The good news is that increasingly we are seeing regulator-mediated policy reform now that is trying to add them so that we can at least ensure that the quality of service they deliver at that level is good. And hopefully that then brings care closer. But of course, there are also traditional norms, value systems that if we can work across will make a major difference in terms of expanding access to care and ensuring that the care is of good quality.